The National Association of Social Workers celebrates 60 years of service as social work paves the way for change.
My name is Athena Viscusi, and I have a full membership with NASW. I'm a member of the DC Metro chapter also. Actually, I was working in tenant organizing in New York in the 1980s. The problem of housing justice seemed like such a big problem at the time. And of course, I learned later that's just a facet of all the problems that poor people face in this country. But I wanted more skills to understand what was going on, to know how to work with people and how to make a difference. What I would like young social workers to be doing is developing new models of delivering services. I think we've had the government model, the nonprofit model, the private model. We haven't got the answers yet, and I really look to young people with all the tech savviness that they have that I don't, and that they're able to communicate globally better than ever. Maybe there's models in other countries. There's cooperative models of delivering services. I'm thinking of Greece, right now. There's all kinds of models all over the world that could benefit us here, and then we have all kinds of lessons that could benefit other countries. Internationally, well, I myself work off and on with Doctors Without Borders in emergency projects, doing mental health programs, and I would like to see a much greater presence of social workers. I think we have the unique skills that are needed in international crises, because we can deal both with individual needs and community needs and even societal factors, that we know how to examine a problem holistically like that and how to design perfect services. And when I go work abroad, I worked in DC for about 20 years before I started going abroad, and I really wanted to see if what I knew could translate, everywhere, and then I wanted to, obviously, to make a difference abroad. So I did some missions with Doctors Without Borders, mostly in Haiti, and after the earthquake, and then in refugee camps in Africa and in Asia. And when the Ebola, I had been to Liberia before, and so when Ebola hit Liberia, I really wanted to go and be able to help. So I was really humbled to work alongside my Liberian colleagues. Doctors Without Borders was running the biggest Ebola treatment center ever built in Monrovia. So it was there was a need for the kind of things that social workers do at all levels. Medical care is only a small part of what it's needed to stop an epidemic. And social workers should be involved in epidemics all over the world. I hope I do get the opportunity again to go back and work in West Africa. One of the most moving things that we were able to do is I was able to train some survivors of Ebola as kind of assistant paraprofessional counselors. Because once you've survived the disease, you're immune. So they could spend more time inside the, red zone that we call it, with the contagious patients, because they didn't have fear of contagion themselves. The work is hard because in order to talk to patients, I had to wear the whole protective gear, which is very, you can last about, it's 80 degrees. The hospital is built outdoors, so it's 80 degrees outside. You're wearing a suit. It's about 110 degrees inside. So you have to be very efficient in your interactions with the patients. And I also love working collaboratively with healthcare teams, because I think what we bring to the delivery of healthcare, and doctors always tell me this, really enhances the welfare and the outcomes of patients when social workers are involved. In NASW, I've been involved in my local chapter. I've been on the nominating committee for my local chapter. What I've mostly done is been involved with trainings. We have our chapter has a local conference, and I always like to talk about what I know. When I work abroad, I'm often the only person in my field, you know, on the team. So it's so nice for me to come back to DC and consult with my peers. I think social workers are the people who have the skills to look at problems critically, to look at them holistically, and to deliver them competently and sensitively.